right,
Mm.
guys. So I got another Democrat I'm about to play a clip on. We have a lot of old videos talking about this fool. You can go check out our old stuff. It was a oldie but a goodie. Here we go. Let me play him.
About this. I'm a black man in America. The reason why heart disease.
I'm white, I can't comment on
Listen
it.
to what I'm
Is that
saying.
what
The
you're
reason
saying?
why heart disease and cancer
pretty
and
racist.
obesity
I can't
and
comment on it.
diabetes are bigger in the black community is because of the stress we carry from having to deal with being called the N-word directly or indirectly every day. If you can't be calm about this,
Jeez. Gray, what do you think about what he said? Why do black people in this country have such health disparities? And I'm actually going to play another clip of my reason why, but I'll let you say your reason why.
I mean, we're more likely to have high blood pressure. I have high blood pressure. I'm definitely not gonna blame it on the N word. My doctor would be upset as much as we talk. Shout out Dr. Ball. And I was in the fitness industry, the CrossFit industry, doing software for a long time. So I'm definitely more pro health with a person eating right and a person working out. So I feel like it's irresponsible to say it's a social thing. I mean, stress does kill, but health wise, if you have heart disease issues or things with your health, look at your diet, go work out, and go talk to your doctor.
That's a great answer, Gray. Taking personal accountability. Kamal, the other FBA on the line, why are black people so unhealthy in America? Is it due to the N word?
I mean, that's dumb as hell. It's not due to the N word because you either fat as hell or you just ain't eating right and eating cookies and Twinkies and shit. Look, I'm gonna be real though. Like, I'm in the health somewhat. I work out, stretch, and all that good shit. I'm in okay shape. I used to play basketball and that good jazz. But we can't forget the fact though, it is some environmental racism going on, and they putting Tesla factories next to black communities and all types of other bullshit that gives you cancer and stuff like that. So I ain't gonna negate that fact, even though I'm doing okay in the health department and working out and in the fitness somewhat and stuff like that. You feel me? You do gotta get up and get it yourself, but I ain't gonna disregard those issues and those certain things that is going on. You feel me?
I think it goes back further, but I'll play the clip and we can talk about it. Enzo, I know I'm not going to ask you comments on that, but as a white man in America, what are you thinking when you're listening to him say that?
People, how do I frame it? I just think it's more less a cop out and saying like, well, this is why all this is going on. Like that's what I just really think about it. But
A skeptic, what do you think?
I think if he was referring to the history of America, it makes sense. If we know anything about historically speaking before the emancipation, they gave slaves rations of foods and pork and certain other foods like watermelon was a staple because it was easy to grow. That was then became cultural. And I think that I love soul food, and like my mother-in-law cooks like the best greens and she does use a lot of pork. So I think that maybe it has become a custom because of, certain like
Right.
ingredients and certain ways of cooking get passed down generationally. So I can see if that's what he was speaking on, I can see how there's a correlation there. But I mean, I think as a whole, I think Americans are just not the healthiest. I think
Healthy.
we a lot of
Mhm.
processed foods. So I think that as a whole, we need to, begin to eat a little bit more clean.
Well, I think it does go back to slavery. I'm gonna play a clip because I don't think bruh didn't land it right. Bruh didn't land it right. So we gonna land it right tonight to give bruh the words.
Of all these disparities.
For too many of us, our primary health care comes in emergency rooms. Instead of preventive care, we're in catastrophic care.
African American men who, at an alarming rate, have been diagnosed with prostate cancer.
Health disparities between black women and white women are well documented.
Did you know that African Americans are almost twice as likely to have diabetes?
I would have to say, just based off of the patient population that I've experienced, during my time here in Minnesota in my professional career, and even in residency, we as African Americans will present one for later stages for cancers, more malignant forms of hypertension, uncontrolled diabetes, overweight. There's also some resistance to the whole health culture.
Mental health issues are real, and we have to understand that we can't pray away everything.
Your health transfers over into other parts of your life.
Reality is that African Americans have been neglected and mistreated by medicine, health insurance, as well as banking and other financial systems.
African Americans didn't come to this country as buyers and sellers and participants in the market in a traditional way. We were the property in the market that was being bought and sold.
Medical experiments, malnourishment, poor hygiene, sexual assault, exposure to disease, violence, and many other maladies were visited upon the physical and mental health of enslaved Africans.
The other thing that many people don't know is that for us, on many plantations, health care was attended to by veterinarians, not by physicians. So there's been a long, deep distrust of health and the care of our people.
The medical and scientific community supported racist ideology with diagnoses specifically for blacks. Medical science even identified being black as a disorder, calling it negritude.
The slave owners had to justify their treatment of my ancestors by convincing themselves that we were an inferior people, therefore denying health care, denying education, denying family, so they could live with themselves.
Following slavery, from Reconstruction through Jim Crow segregation, separate but equal laws perpetuated the unequal access to health care. Some scholars conclude that much of today's health disparities are directly attributable to the slave health deficit and all that followed. But too often the focus is on the problems, pain, and pathos found in African American history. Discovering truth, revealing little-known realities, and surprising stories can offer inspiration and
Okay, Kamal, what do you think about that clip and linking it back to slavery and the history of Black Americans in this country?
I mean, the shit was true. You feel me? At medical racism, they was doing experimentation on us and stuff like that. And not only that, it's like we gained a distrust of the medical field, but when we go there, they misdiagnosing us. They doing this shit today. I ain't even gonna mention somebody, but it was somebody I listened to, and they said they were having migraines and shit, and went to the doctor, and basically the doctor basically said, "Hey, rub some Robitussin on that shit, and you be all right." Told him get some damn Tylenol. Like, you feel me? I got my other bruh. You feel? Because like I said, used to hoop. You feel me? So I be around hoopers, and we get injuries and things in that nature. He got misdiagnosed with a knee injury. You feel me? They saying it's one thing, and it's something completely different, which fucks up his leg even more. They done misdiagnosed me with shit when it comes to my leg injuries and things in that nature. But we supposed to be having trust in the medical field since this shit been happening since like slavery. Man, I got a story for y'all. Did y'all know that the coldest slave owner, y'all, I know y'all gonna be shocked, you feel me when I say it, wasn't even a white man. It was a white woman. You know this broad was doing experimentation and doing the goddamn human centipede type of shit, taking motherfuckers' arm, sewing it to people's asses, taking people goddamn legs, sewing it to
What
their
is
arms.
this? What state?
I never heard. They
Bruh,
didn't make a movie out of this. I never heard of this.
Well,
bruh,
the worst one in Jamaica was a white woman too. They call her the White Witch. The
the
white. If
white.
you ever go to Jamaica, look up
I've
the
been to
White
the
Rose
mansion.
Hall. Yeah, it was a
Really?
Yeah,
white
the White
woman.
Witch
See,
Mansion.
I'm
Yeah.
telling you.
cold
Was
part.
that like a tourist attraction in Jamaica?
Yeah,
We
it's
met a
in
guy and
Jamaica.
he gave us a tour and he was like,
Yeah,
"Y'all want to go to the white?" And he was like, "Yeah, White Witch Mansion." He took us.
it's
Like, what is
haunted.
this? Yeah.
Hmm.
That's
Cold
wild.
game.
Yeah.
And another thing, though, they were experimenting
Oh,
on us.
Alexis
Yeah.
knows.
Yeah.
Yeah,
Madame
Alexis knows
Lavaurie.
everything.
shout out to
That's her.
Alexis
Yeah, shout out to Alexis. Thank you for that
for
info. You
knowing
feel
that.
me? Hell yeah.
Yeah,
But the modern medicines we have today and certain things that they had to test it on somebody, right? They tested it
right.
on our ass.
And so when we talk about this story, it's not looking for, like to drag it out and belabor it, but it's to bring a knowledge and a awareness, because he's saying misinformation by going on there and he's making it sound crazy. So I wanted to talk about this in a way where we say why there is some relevance to what he said, but not to the way he said. You know what I mean? Obviously, it's not the word itself, but it's the racism. It's the misdiagnosing, like Kamal said. It's going back to the food, like Skeptic said. Skeptic had a good point too. Gray, somebody that came from a sharecropper family and sharecropper background. What is your thoughts? Do you now agree with that, or do you disagree? Do you think it's accountability to this day in 2025?
I disagree because my girlfriend is Puerto Rican and Italian, and she's in research. She researched medication. So when they test a medication, they do random tests on people. And she's the one that told me this. She said that they didn't do the proper research for black people and mostly women overall. So they're trying to do some
Wow.
type of correction where they're trying to like research. I don't know if I'm allowed to say the stuff. She's who I was with in Chicago, but they're allowed to like research minorities. They're specifically looking for specific people so they can tell the FDA, hey, we looked at this for this specific group of people with these medications. And also, some of the most health conscious people I know are black vegans, like people that pescatarians. I've known plenty of black people that are like
True.
very health conscious. Now there is an issue with older black men going to the doctor. So like a lot of the people, they don't go to the doctor. So if you go to the doctor and you get your diagnosis, you probably can catch a lot of stuff before it gets worse.
I
True.
did want to say that there is history. I know that in Mississippi they had like the Mississippi appendectomy or whatever, where they were removing. I want to say it was in like 1980s. They were removing women's like uteruses and sterilizing them. And in Puerto Rico, they also experimented on Puerto Rican women to where I think it was like 1/3 of Puerto Rican women became sterile because they actually were coming up with the birth control medication, and so they used Puerto Rican women to experiment on them. And then you have like the Tuskegee experiments, where they put
True.
syphilis into the black community and did not tell the men what they were actually doing or give them the shot to cure it. They allowed, and I want to say it went on for 30 years. So I can see why there's a distrust even now when you look at mortality rates. Mortality rates for a black woman that's going into labor is like 40 something percent when it's 19 or 12% for a white woman. So I
Yeah.
think that there's a disparity there. I don't know if it's malpractice. I don't know if it's because there's a widespread of maybe in the medical field, certain people
True.
believing that because you are a minority that you have higher pain tolerance. And I think that that
True.
creates a different way that they come towards how to provide you care. And like I've been given the advice, my daughter who's mixed, like my mother-in-law told me to take her to a doctor who was black. Don't take her to a white doctor because you have a higher chance of being misdiagnosed. And she had like a rare skin condition, and I'm actually glad that I did do that because I didn't want her to be misdiagnosed. Like Kamal was saying, I don't want her to have to go through trauma and then not trust doctors because that doctor they look at you and they have this, they kind of sum up certain things about you, and they may think that you just want pain medication or that you're
True.
over exaggerating or something. And so I do think that there are disparities because we can look at statistics and see that we are seeing a correlation there. So I definitely I definitely agree with that.
Facts. Enzo, anything you want to add before we move on?
Mhm. Thank you for showing the video. To actually open my eyes and just have a different opinion about it now with everything Kamal was saying too. I see it a little bit
Yeah.
differently now. I can understand where this what he was trying to say now a little bit more. And yeah, he did miss the point on that. If he would explain it a little bit better, then somebody like me, I'm just the neighborhood white guy on the panel. Um, I would understand it a little bit better, but just the way that it was explained, I typically wouldn't agree fully. But I mean, so thank you for that.
It's the politicians' fault, man. I'm just realizing these
I agree.
motherfuckers stupid. I'm sorry. They don't know shit. They don't
Mhm.
like. It's too many of them
But
that just don't be
come
knowing
on.
nothing.
They're the ones that are being propped up and paid and funded. I mean, he did go against APAC, so I won't say he's part of that. That's why he lost. But anyways, another conversation for another
I
day. But
want to
yeah,
add
they're the
something.
ones being propped up. Sorry, go ahead, Gray.
Well, with all of us, all our doctors are gonna graduate from medical school using Chat GPT, so we're screwed worse. So I mean,
You got a point
No,
there.
let me tell y'all, the resident caught my daughter's appendicitis. So that's not always true, but
Y'all cooked.
yeah, but I will tell you maybe when I do on the women's show one day, but it has been a lot of discrepancies with women lately, especially women of color when it comes to pregnancy and different things like that. And it's only gotten worse. You're going to be shocked by what I'm about to say, skeptic, but it's only gotten worse since the abortion ban was put in effect. But that's a conversation for another day. But anyways, y'all, we're going to talk about Candace now. So for all the MAGA